Everyone in Australia will have access to COVID-19 vaccines. Australia has purchased more than enough vaccines for everyone. But first, each vaccine must get the tick of approval from Australia's health regulators. All up, Australia has purchased more than 100 million doses of COVID-19 vaccines to be able to quickly and effectively deliver the vaccines to everyone in Australia. Each vaccine is rigorously tested to meet the standards of our world-leading regulator, the Therapeutic Goods Administration, or TGA. The TGA reviews clinical trial data and results for assessment of potential COVID-19 vaccines. Now that our first vaccine has been approved, it will be made available to those most at risk. They include health, aged and disability care workers, aged and disability care residents, and hotel quarantine workers. Once more supplies are available, the vaccines will be rolled out to all Australians in batches throughout this year. 2 doses will be needed per person to offer the best protection. The vaccines will be an important part of our fight against COVID-19, helping to prevent death and serious illness. Despite this, the approval will not be rushed. In the meantime, we all need to continue to be COVID safe by practicing good hygiene, physical distancing, and getting tested. To learn more, visit health.gov.au.
Welcome everybody to the new program, how to stop the spread of coronavirus, and the new variants are out and about in our society. So I'm your host, Syed Asad Ali Taqvi. We're going to discuss today. We got our special guest from Sydney, brother Dr. Basim Al Ansari. Assalamu alaikum, brother. How are you?
Alaikum assalam wa rahmatullah. How are you, brother? Inshallah, good.
Good to see you again, and thank you very much for taking your precious time out for this program for our small community. So let's just discuss few things regarding COVID-19 and different questions I got from part of the community that they have some concerns and they have some questions up. So I thought it would be a good idea to discuss this today. So we can start our program with those questionnaires. So let's just get straight into it. Now, as you know, Islamically as well, they are a bit concerned in our community that people are thinking that is it okay to get COVID-19 vaccination, or is it allowed, or are we doing the wrong thing? Are we doing the right thing? There's still a confusion there. So the question is, Islamically, what are the orders against COVID-19?
Yep. So, Bismillahirrahmanirrahim. First of all, I wish all our viewers, inshallah, happy occasions and happy days because of the great anniversary of the birthday of Imam Ali alayhi salam. And in that same time, I pray to Allah subhanahu wa ta'ala that everyone is protected and that they themselves and their loved ones, inshallah, are kept away from any disease or any misfortune, inshallah. When it comes to protecting oneself and one's family and one's community, it's actually an integral part of our duties as a Muslim. So it goes beyond than the pandemic, but in overall, every one of us is responsible for our own well-being and our family's well-being. And that's why if you see our Maraja from day one that COVID came in, they all issued statements asking people to adhere to the health authorities' messaging. They encouraged everyone to be vigilant and to ensure that they minimize harm, whatever minimize harm means. Sometimes minimizing harm is when you put on a mask. Sometimes minimizing harm when you keep a distance. Sometimes minimizing harm when you actually isolate yourself. Even it went to the extent that our scholars gave permission for Jama'ah prayers to stop, for mosques
mm,
to close. The shrines were, started being, keeping distance between people. So all of these things, even in Jama'ah prayers, our scholars allowed social distancing to exist and Jama'ah prayer to be held that way. So Islam is extremely flexible when it comes to protecting everyone's health. If we actually go further and see, it's an essence message of Islam. For example, if a lady is pregnant and Shahr Ramadan comes, in the month
mm,
of Ramadan, every single one of us is, obliged to fast, and it's an obligation. If we do not fast on purpose, then we actually have to do the lapse fasting. We're also required to pay to feed 60 poor people. Now, feeding the 60 poor people, uh, or fasting for 2 consecutive months, is actually a punishment. It's not
mm,
in any way a replacement. We have committed a sin by actually not following Allah's command. However,
mm,
if a lady is pregnant and she is worried for herself or
mm,
for her baby, she is not only allowed to break the fast, she is not allowed to fast. So the actual ruling that's for us is an
mm,
obligatory for us to fast becomes
mm.
actually the opposite. She is
Ah,
actually not allowed to fast.
mm,
And
mm,
as well as, so now protecting herself and protecting her baby. See? So it's the
mm,
responsibility of one for themselves and for whoever is in their care. So I think that's an illustrated example of daily worship that we
yeah.
actually have to do. If someone has back problems, if someone has a surgery, then
Mm,
our wudu is different. Our prayers allowed to be much easier and much less movement. So
mm,
all of this shows how Islam cares about the health and well-being of the individual as well as
mm.
the society.
Perfect, perfect. Who people who don't know Dr. Basim Al Ansari? He's a son of well-known His Eminence Ansari Ayatollah Ansari, based in Sydney, and he's got tons of knowledge. Islamically, of course, mashallah, but at the same time, he's got tons of knowledge in medical medicine. He's a PhD in medicine, and he works closely with the Department of Health in Sydney. So lots
Thank
of
you
contribution,
for your
brother.
positive image, but I think the
You
task
you
should be rewarded.
you
I
got a
think
lot
some
of
people
lots of um, contribution in the community, and that it's not been forgotten, and everybody knows that what amazing work you and your dad and everybody in your team is doing. It's a fantastic, and we are lucky in this country that we have people like yourself, a community leaders who's looking after other community members as well, so which is fantastic. Now moving on to the next one, the next question is, what do our duties to protect us? And I think you touch base on this one as well. So what are our duty to protect us and the communities from COVID-19? So you touch base, the marja mention about how to protect yourself and others as well. So if you can shed some light regarding in community, what are our duties to protect ourselves and the community members?
So it comes from the perspective, like, I'll give you a very good example. Sayyid Grand Ayatollah Sayyid Sistani was asked in a written statement. So this is a written fatwa. The question was to him that if I know that I have, or someone knows that they have COVID-19, yet they go and participate in a community gathering
Hmm.
where they know that others might get impacted and it might lead to severe consequences for them.
Hmm.
Grand Ayatollah Sistani's answer was, it is not allowed for that person to go to that gathering, and if they do and someone dies as a consequence of that transmission, then that person has to pay the diya,
Wow.
the family of the deceased. because they were the cause of that misfortune. So I think Grand Ayatollah Sistani, as well as the Grand Ayatollah Fayyad, the Grand Ayatollah Najafi, Grand Ayatollah Wahid Khurasani, Grand Ayatollah Khamenei, and all our Maraja in Qom and Najaf have been extremely clear that the consequences of one's action is responsible for it. Now,
It's like
having
killing
said,
someone.
sorry,
It's like killing someone. It's like
it's
intentionally killing someone.
you're leading to the death. Of course, as you know, Islamically as well as legally, even in common law, we differentiate between manslaughter and you're actively seeking to kill someone, and when you've been the cause of that or a trigger to that death. So it is not saying that they should be punished as if they killed someone,
Mm.
but literally they were an instrumental figure in the cause or the risk factor for that death to occur. Now, I want to emphasize one thing, that, mashallah, our community mostly have been extremely cooperative. Like for the last 2 years, I have to say, the community in Sydney, in Melbourne, anywhere in Australia, we did not have, alhamdulillah, this is a magnificent result. We did not see anyone in our community in any way. I'm not saying in every individual, but I'm saying as a community.
Breaching.
We thought, I'm very proud of our community. We were extremely careful. We all took care as much as possible. Now, some individuals might have looked at it as, conspiracy theories, and might have looked at it as, there is some sort of plans for global domination or anything like that.
Mm.
Now, whether these claims accurate or not, see, all our scholars, and what I am actually emphasizing here, it is not to say if the virus was man-made or not, if it was
Mm.
natural order of things or not, if the government had agenda or not. That is not what we are discussing. We are just discussing our reaction to something that in reality has happened. We're
Mm.
talking about facing the practicalities of the day. Whether has been a conspiracy behind it or not, that is not something that our scholars are saying that exists or doesn't exist. That's for history to be judgmental of that. We're just talking about my duties as a person and as a community,
Mm.
in face of the practicalities of everyday life. That's
Absolutely.
extremely important to differentiate. When we're saying be careful, when we're saying take care, when we're saying vaccinate, at no point we're saying that we endorse what happened, nor we endorse any governmental messaging or any sort of other messaging that might exist. We endorse the health authorities' concern for the health of the public. Yes, that's extremely important to differentiate. And sorry for taking my time to emphasize
No,
this
no, no,
point,
no. You go
but
ahead. No, perfect.
I think it's very important to differentiate between the two lines.
No, absolutely. I mean, because in our community, one answer is not enough. So in details, when you explain things, that it's much better to understand what's the message is. So and you clearly explain it in the right way. So thanks for doing that. Now, does this vaccination is because this is another I say a myth out there that vaccination doesn't work. I don't know if it's halal or not, or they're putting a chip in our body so that they can track. So there are like different stories you hear, some weird stories you hear in our community. It's not like because they are they're thinking that way. It's just because what they hear from other people, and then it just spread like a virus. So what do you have to say about that? So it's, is it halal, or is it like putting the chip so that they can track every single individual?
Okay, so I'm going to differentiate my answer into two answers. The first one, I'm going to answer it religiously, and the second, I'm going to answer it professionally as a medical, professional.
Yeah,
The
professional. Yeah.
first answer religiously is that yes, all these vaccinations that are available so far widely. It doesn't mean every single vaccination, but Moderna, Pfizer, AstraZeneca, and of course we have recently the protein-based Vivax. All of these ones, um, we do not have any indication they are not halal. Actually, we have the WHO and all the global bodies have looked into it, and they are actually free from any component that would deem them haram.
Mm.
Um, Vaccinations in Islamically, by majority of Islamic scholars, whether Sunni or Shia, have been endorsed over the last decades till now. And again, Islam believes in prevention. Islam believes in protecting society. So we do not have any clear fatwa against any of the vaccinations or any indication that any of the vaccination should be prohibited. So that's extremely important. Now, I would like to answer it as a medical professional to the second bit, which is chips and so on and so on. The fact is, first, before I was a professional, possibly as a joke, one of my friends always repeats it, and he says, "Well, they don't really need to chip our bodies when every one of us has an iPhone or a Samsung.
That's a good one.
Chip our phones. Like they chipped. Like the phones have
Or you can track. Yeah, that's fair
that.
enough. Yeah.
We are addicted to these
True.
devices so much that honestly, do you need to chip anyone anymore?
Yeah.
It's very interesting. Like if you look at the now I want to go medically and answer it. If you look at the
Mhm.
psychological effects of using our devices and the screen time and the amount of screen times we give our kids, where it's affecting the new generation growing up in a bizarre way that we have no idea, honestly. Um, you would not even think of chipping. Why would you chip anymore? We are voluntarily chipping our
Mm.
kids. If we
Mm.
if we want to have a conversation, let's have a conversation. And in our community, unfortunately, when you go to the mosque and you go to the community centers, you have the program running, and every kid has a mobile phone and sitting somewhere in the corner, and their mind and whole body and attention to that mobile phone. I'm not saying every kid, but many of the kids. And
Mm.
now, if we want to question, let's question our parenthood,
Mm. Mm.
skills. Let's question what are we doing as a community to make sure that the internet and technology is a useful tool for our kids and for our upbringing. If we want to
Mm.
have a conversation, let's have conversation there. It's very easy to blame others and to create enemies and to say everyone is trying to get me. But
Mm.
honestly, are we protecting our kids from things that are very obvious?
Yeah.
The influence of internet and the influence of social media is extremely obvious.
Mm.
All the psychological burden that our teenagers are going through because of social media is obvious. the
Mm.
the mistreatment, the misalignment, the miscommunication, the unfortunate consequences of that has been actually a lot of people are being led away from our Islamic teaching, from our way of Islamic way of life. What are
Mm.
we doing about that? If we really want to be concerned about chipping, let's start there.
Mm.
So honestly, I don't see why the governments need to introduce a chip when we're already chipped. That,
Yeah.
that that's a general answer. On the medical front,
Mm.
the technology of using mRNA is actually has been in for vaccinations has been in research and progress and development for over a few years. Like it's possibly 20-30 years that the research has been done. It's just that we have never used it on human beings before
Mm.
COVID-19. And obviously in COVID-19, huge clinical studies happened before it was introduced to the human body. um, to the extent possible, It is safe, and the long-term effects, of course, are studied well in a lab-controlled setting. Now, obviously, some people might still have concern around that. Now, if you have concern, AstraZeneca is totally different. AstraZeneca, for example, because mRNA is Pfizer and Moderna. When we come to AstraZeneca, for example, it does not use mRNA technology, so there is no chipping or anything. But despite the fact that mRNA used has no chips, actually it doesn't have chip ability because it does not go in the nucleus of the cell. So it doesn't go in the actual genome of the body. It actually goes only in the cytoplasm, and it affects the factory of producing the protein that then the cell shows, so that it attracts the immune system or triggers the immune system. That's from an mRNA vaccine perspective. From the AstraZeneca perspective, it's actually a weakened virus, and we have these vaccinations for many years now, and we have actually the flu that we get every single year, the booster flu, and most of us get it every year, especially in Australia. It's actually a weakened virus. That carries the messaging we want for the body to trigger the immune system. That's exactly the same technology used. Now, if someone is concerned, then the new protein-based vaccines, and alhamdulillah, now we have them in Australia since in a couple of weeks now. These are protein-based, so actually they don't get the cell to do anything. They actually have the protein that the cell has to show on the cells included in the injection, so it literally goes into the body, shows the protein, and then triggers the immune system. So it does not interfere at all with the cell function. Sorry, it was a very long answer, but there are different perspectives that needs to be answered here. Syed Asad, you're there?
Yeah, perfect. Now move on to the next one. Can you hear me well?
Yes, I can hear you. Can you hear me well?
Yeah, can you hear me?
Yes, I can hear you very well, Syed.
All right. So the next question is, um, you already mentioned this one, so we skip that question. So, what do you say regarding those who are not getting vaccinated, like anti-vax? You see lots of protests in Sydney, in Melbourne as well. So, so people are not getting vaccinated, anti-vax people, and what are the effect on us if they don't get vaccinated?
Okay, so there is a difference between anti-vax and people who don't get vaccinated. I think anti-vax are the people who encourage others to not vaccinate,
Mm,
and possibly start, questioning the whole thing. There's a lot of people who choose to not vaccinate out of free will,
mm,
and that's different to an anti-vax. I think that's extremely important to differentiate between the two. Um, I strongly believe that getting vaccinated is a personal choice.
okay.
It is your personal choice. It is your own body, and in front of Allah Subhanahu wa Taala, you are responsible for what do you do with your body. And obviously, that's a relationship between the individual and their creator. I strongly believe that people should be looking at their individual situation. They should
Mm,
look at their duties towards their um, immediate family, because some people, they don't want to vaccinate, but at the same times they don't expose any risk to others. They protect themselves. They try to not expose themselves to anywhere that might expose them to the virus.
mm,
It is their personal choice. Of course, we know that now through studies and evidence that
mm,
people who are not vaccinated are more prone to catch the virus,
mm,
uh, transmit the virus, as well as harder,
mm,
get hit harder by the virus. So, provide yeah, if you look at the hospitalization cases, if you are unvaccinated, your chances of getting hospitalized is higher. The chances of those hospitalized to get to ICU higher, and obviously, unfortunately, the risk of death is higher. But again, having said that, it is a personal choice, and I am uh, fully aware of the right of every individual to basically make their own choice.
Fair enough. Fair enough. Now, from that, there is another question come in mind is that even if you get vaccinated, second dose, and when you get COVID, you still get COVID-19, regardless of if you got a dose or not. But you think once you are fully vaccinated, the COVID will hit you less as compared to someone who's not vaccinated?
Yes. So again, when we compare on a population base. So the when it comes to these vaccinations and so on, it's a public health formula that's applied, and looking at overall population numbers, then the percentage of people who get COVID who are vaccinated, and if we compare them to the same percentage of people who get COVID who are unvaccinated, we see that those unvaccinated are actually at worse disease symptoms than those who are vaccinated. Actually, a study was done in Melbourne a few months ago where it showed that people who are vaccinated are 10 times less um, prone to actually continue to full on blown out disease compared to the people who are unvaccinated. So, um, you know, I think some of the evidence is very clear for us to see, and it's all published and all available.
At least you will not end up in ICU. That's what I've seen so far, whoever I know.
Yes, yes,
Yeah. So at least you will get a moderate to mild symptoms. Some people get a little bit more. But whoever I know, that they didn't, they got the COVID-19, but they didn't end up in an ICU, which is a good thing.
yes.
Now,
So your chances of needing to be um, being in the ICU and being under critical medical care is less.
Now, those people who are in hospital for other disease like heart disease, or they have other serious issues as well. So you think even though you are vaccinated, you are still in risk of, you
Of
know,
course, of course, of course. And one of the biggest, issue that we have, obviously, with the numbers going up, and why there was a push for all of these measures to take place, is to bring the burden on our hospitals down, because as you know, the more people, the more numbers that are infected, the more percentage of people that need to be hospitalized, and obviously if you're hospitalized, then you're not affecting only the healthcare workers, but you are actually now taking beds of hospital that's needed for other cardiac patients, for all types of cancer and so on. So the unfortunate reality is, um, those who are affected by chronic diseases or acute emergency situations are not only affected because they're prone to more risk of infection and therefore complicating the disease, but also they have less chances of getting the specialist care that they need because of the overwhelmed healthcare system that we have. And the premier of Melbourne was very open about it, and that's why he is bringing a lot of healthcare staff from overseas, because we literally do not have. And myself, of course, I lead one of the healthcare organizations in Sydney, and
yes.
when our staff are affected by COVID, it really, really affects us, because now obviously they have to isolate, and then you have to replace them. You have to cancel appointments. Some people are critical and they don't want to be delayed even further. It's a very it's taking its toll on of us, all of us in healthcare industry. It's taking a huge toll on us, and as a result, of course, on the population.
Now, talking about immunity, you say like if you have if you don't have a better immunity, then most likely you will get COVID, and then you will get really bad COVID, and then they go to grandma medications. They say, or eat garlic, or do all those sort of medications. The general things that food items that you eat, and then you will get better. So you think that herbal, I should say, herbal treatment as compared to the medical industry, is that going to help you?
So at the moment for COVID, we don't have medical treatment. Yes, if someone is immunocompromised, then a certain antiviral combination is given to them. But generally, if someone has COVID, two things you should be doing. First of all, symptomatic treatment. So if you have any sort of symptoms, then you go with the classical treatment for that symptom. Also, the second thing is taking any thing that boosts your immune system. Now, some people might choose to have vitamin C, extremely useful. Definitely is the right way to go. That can be in an orange juice, can be in other formats. Some people go for garlic, some people go for onions, and different herbal medicine that they want to use. Um, what is very important is to rest, have as much healthy food that boosts your immune system as possible, and obviously, inshallah, you recover in the meantime.
And they say fluid, lots of fluid if you take,
Lots
because
of fluid, yes, yes, yes. Because of course, if you have, especially if you have a high fever,
okay.
because you might dehydrate your body. So lots
Mm,
of fluid, obviously, and rest as well as boosting your immune system. And
mm,
very importantly, I have to say is that if you have a high temperature, then obviously you take paracetamol or anything like that to bring it down.
mm,
At the end of the day, it's like any other flu.
mm.
Exactly what you do for other flu, you exactly do the same thing.
Because what I've seen in the community and I've heard as well, the most common ones for those who got vaccinated when they get the COVID, the most common ones symptoms are they get headache, they cannot taste, so the taste and smell's gone completely. They runny nose and sore throat and coughing as well as part of it, and usually it takes a week or so for them to get better. So less than 14 days it takes for them to getting to that stage of getting better, because I think um your dose, whatever you had COVID-19 double dose, will fight back. Is that way it works, like your dose, whatever you had double doses, then fight back, that's the reason you're recovering faster?
Sorry, can you reword that question, because I'm not sure if I follow the question. Sorry.
People who get vaccinated and then they get the COVID as well. So usually after those getting, after getting those symptoms of headache and sore throat and coughing, they say the symptoms goes away in time. So they recover much faster. So it doesn't take 14 days. It takes like a week or so, less than 14 days, but they recover faster. People thinking the community question is that, is it because they got the vaccination in their body, like because they're vaccinated, is that thing is protecting them, that dose is protecting, that's the reason they get recovering faster?
So um, again, how does vaccines work? A bit of hint there. What vaccine does is actually exposes your immune system to a virus-like um, reaction, so that the body develops the antibodies from before.
Okay.
So then the body has some sort of memory and I'm not going to go into details here to not bore the listeners, that it keeps memory that if such a disease hits me again, or such a virus hits me again, then I should be making those antibodies. So when the vaccination basically gives you a weakened virus or a reaction of that virus, it triggers it in your body. So then when you, inshallah, Allah subhanahu wa ta'ala never, it protects you, but I mean you as a person, then when the person gets the virus for real, then obviously the body will take less time to develop those antibodies because it already triggers its memory of developing these antibodies before. And that's why we say if someone has got COVID for 28 days to 2 months, they already have protection because their immune system is already at the peak of its response to the virus. So yes, because of that, it does make the days that you need to recover from those symptoms much shorter.
So most likely after getting a COVID, what's the span? What's the time frame that you will get it
It has
again?
been so different. It's amazing. It has been so different. It's amazing, and that's why if you look at, for example, a lot of people say, well, why the government keeps changing the guidelines? Why they keep saying, isolate for 2 weeks, then isolate for 6 days, then isolate for a week, for 5 days? Because different studies are different. Because different people are different. It's extremely interesting how different people are reacting to it differently. So I can't give you a period, but definitely the 6 days that at the moment recommended by health authorities in Australia is the official line that we go by.
Some people are saying that you got after the second dose, you got the COVID, so that means that's the booster for you.
Sorry, your sound is breaking up. Sorry.
Sound background. Can you hear me now?
And I'm still breaking up. Sorry.
Sound background. All right. No worries. Can you hear me? No.
No, still.
Still okay. Let's just try to fix it. Can you hear me? Can you hear me now?
I can hear you, but there is some sort of like echo and a bit of turbulence.
Sure. How about now? No, still?
Still the same.
Okay. Sorry about
No,
that.
I can still recognize what you are asking, possibly, but I'm not sure if the listeners have the same quality.
Yeah.
As I am.
No. Okay. Technical issues. So just wait for Brother Basim to join us again.
Everyone in Australia will have access to COVID-19 vaccines. Australia has purchased more than enough vaccines for everyone. But first, each vaccine must get the tick of approval from Australia's health regulators. All up, Australia has purchased more than 100 million doses of COVID-19 vaccines to be able to quickly and effectively deliver the vaccines to everyone in Australia. Each vaccine is rigorously tested to meet the standards of our world-leading regulator, the Therapeutic Goods Administration, or TGA. The TGA reviews clinical trial data and results for assessment of potential COVID-19 vaccines. Now that our first vaccine has been approved, it will be made available to those most at risk. They include health, aged and disability care workers, aged and disability care residents, and hotel quarantine workers. Once more supplies are available, the vaccines will be rolled out to all Australians in batches throughout this year. 2 doses will be needed per person to offer the best protection. The vaccines will be an important part of our fight against COVID-19, helping to prevent death and serious illness. Despite this, the approval will not be rushed. In the meantime, we all need to continue to be COVID safe by practicing good hygiene, physical distancing, and getting tested. To learn more, visit health.gov.au.